Hello, my name is Christine Trevino, and this is going to be mini checkoff number 4 ears. This is my note card, and this is my otoscope. I'm walking in the patient's room, closing the door. I'm assessing for privacy, closing that curtain, and I'm washing my hands. Good morning, ma'am. My name is Christine, and I'll be your RN today. Could you please verify for me your full name and date of birth?
Christine Davis, June 3rd, 1958.
Perfect. Thank you for that information, Christine. I'm also Christine.
Oh,
it's nice to have
neat.
another Christine in the house. All right, so today what we're going to be doing is an ear exam. I'm going to be inspecting your ears, but I'm visually from the outside, but I'm also going to look on the inside and see if I see anything that's abnormal. For example, any masses, any lesions, any redness in your ear canal, your tympanic membrane, which is also known as the eardrum, making sure that it looks as it should. Do you have any questions before we begin?
No, ma'am.
Okay, so I'm going to ask you a couple questions to get started. Are you having any trouble hearing?
Yes,
Okay, in which ear?
in my right ear.
In your right ear. And how long has this been going on for?
Couple, 5 years, 6 years.
About 5 or 6 years. Did you, previously were you around a lot of loud noises or anything?
Yes, I was. I worked with loud noises.
Okay, so it was like constantly?
Yes.
Almost every day. All right. So I'll go ahead and document that in your medical record for you, and then we'll make sure we just get a hearing assessment to go along with your exam today.
Okay.
All right. So the first thing I'm going to do is I'm going to go ahead and I'm going to look at your ears. Your ears look symmetrical on both sides. They're at about eye level, so all that looks good. They don't look too low. I'm going to look at this ear first. Is it okay if I touch your hair?
Yes.
Pull it back. Okay. So her ear looks, or her pinna looks as it should. I don't see any little bumps or lumps, any abnormalities. Her earlobe isn't connected, which is actually, if it was connected, kind of a funny thing. That's like a gene, but anyway, mine isn't connected. Do you see mine? Like, so like my or it is connected where yours isn't. Anyway, just some food for thought. So her lobe of her ear looks good. I can see a little bit of her external canal, and that there's no redness, no masses. I don't see any cerumen coming out. She does have a pierced ear over here, a piercing on that lobe. Over here, the pinna looks symmetrical, no bumps or lumps, none of those little bony horns. External canal looks good. I don't see any leakage, anything. Her tragus on both sides looked good. Lobe looks good. On this one, she has a star tattoo on her lobe, and it's also pierced. Okay, so now what I'm going to do is I'm going to feel around on your ears. If you feel any pain, just let me know, okay? So we're going to go ahead and feel anything there. Any pain there?
No.
Okay, I'm going to press back here. This is where your mastoid process is. It feels as it should. No swelling, or is it tender when I push there? Okay. And then on this side, I'm going to go ahead and feel any tenderness there or pain? Anything right there when I find that mastoid process?
No.
Push? Okay, good. All right, so now I'm going to go ahead and I'm going to look inside your ear.
Okay.
Well, actually, before I do that, I'm going to do something called a whisper test. So what that is this part right here is your tragus. So I'm just going to kind of have you push constantly in and out of that. And then in the opposite ear, I'm going to whisper something. And I want you to tell me what I'm whispering, okay?
Okay.
So let's go ahead and start with your left ear. So go ahead and push in and out on that tragus.
I didn't hear anything.
Okay. So we'll try on this side. Go ahead and...
A, B, C.
Okay, let's try this one more time, just to make sure.
I heard it that time. 1, 2, 3.
Okay, good. So that the hearing is good. All right, so now what we're gonna do is I'm going to get my otoscope, which is just the earpiece that has the little light and the little nozzle on it. Okay, so this is my otoscope. I'm gonna make sure I get my little probe to go over it, and then I'm gonna flip it upside down. When I wrap the cord around here. So when I'm looking inside her ear, I'm gonna pull the pin up and back to make sure that that ear canal is nice and straight for me. So I'll go ahead and do that now. Then I'm gonna take the base of my hand and rest it right here. So it's gonna be touching your face. All right, Miss Susan? Okay, and I'm gonna be looking in her ear. I'm looking in her canal. I see a little bit of cerumen, but not too much. I can see her tympanic membrane. It's pearly gray. And I can also see the cone of light. No redness or anything. Did it hurt when I pulled back on your ear?
No.
Okay. So same thing on this side. I'm just gonna switch hands here. And this time I'm gonna pull, again, back and up. And I'm gonna rest my hand against her face here, making sure I don't slip or trip and like hit her, bruise her, injure her with it. And I'm looking in her ear canal. Looks really good in here. Miss Susan, you don't use Q-tips, do you?
No.
Oh, good. Okay. All right. So hardly any cerumen in this one. So this one looks really, really good. I can see her tympanic membrane. It's pearly gray. And also the cone of light. All right. I'm going to take my little probe off and I'm going to throw it away. I'm going to grab an alcohol wipe because I had one, you know, spare by. And then I'm just going to go ahead and clean everything just in case anything got on there and set that down. All right, ma'am. Well, this completes your exam today. I'll go ahead and document that hearing deficiency, and then I'm going to have you go down the hall and do your hearing test. Are you okay with that?
Yes.
All right. So you can go ahead and you can wait in the lobby, and I'll be right back with you. Thank you.
Okay, thank you.
Okay.